Welcome back to Doc Hobby 2020. Please participate in the polls that appear on top right of your screen. For social message, please go to last few minutes of the video. Today's topic is paroxysmal nocturnal hemoglobinuria. Before we go to the topic, usual reminder that medicines are not to be taken without doctor's prescription. Here we have a 28-year-old male who came to OPD describing his 12 hours old agony. He said he has relationship issues with his wife, blood in urine, bleeding gums and dysphagia. He didn't pass any clots or felt any discomfort during micturition or had any edema of renal origin. But he complained of episodes of passing dark urine frequently and foreign body sensation in throat. Doctor suspected that patient was hiding a problem troubling him and found out that it's sex-related issue and asked for his consent to inquire about the same. Seeing patient getting uncomfortable, he sent patient for investigations, giving him enough time to prepare himself. Patient agreed to answer and doctor completed his queries related to his erection problem, which included questions on getting enough erection for penetration and maintaining it throughout the act of coitus and his satisfaction after the act. Based on his responses, International Index for Erectile Function score was 9 out of 25, which classifies him under patient having moderate erectile dysfunction. On examination, vitals are stable, but petechiae were noted on removing BP cuff. Pallor was detected. Investigations revealed decreased blood cell count suggesting pancytopenia. Mild reticulocytosis with increased LDH and decreased haptoglobin suggested intravascular hemolysis. Urine on centrifugation showed red supernatant indicating hemoglobinuria, unlike hematuria in which it is pale. Sediment showed positive for hemosiderin. Bone marrow is hypoplastic. Flow cytometry showed positive for PNH cells. Let us discuss our diagnosis. Mutation in phosphatidylinoacetylglycan A gene resulted in absent glycosyl phosphatidylinoacetyl anchor protein in hemopoietic stem cells and other complement regulating surface proteins, causing uncontrolled amplification of complement proteins lysing the cells. The name was derived from the belief that increased carbon dioxide during sleep causes acidosis activating complement, but later it was disproved. Hemoglobin released into circulation binds to haptoglobin, and when haptoglobin is completely used up, free hemoglobin levels increase in plasma, depleting nitric oxide levels, resulting in erectile dysfunction, esophageal spasm, and other symptoms related to smooth muscles. Now the treatment includes anabolic steroids for erythropoiesis and eculizumab against complement, which makes the patient susceptible to infections with encapsulated organisms like Neisseria. So advice should be given on vaccination and prophylactic antibiotic therapy with penicillin V, and also need for repeated blood transfusions and bone marrow transplantation should be explained. Follow-up if symptoms persist, otherwise annual follow-up to check remission. Before coming to social advice on how to talk about sex life to your doctor, let us see why he actually needs it in the first place. To promote contraception, to screen high-risk behavior, to identify and treat any sex-related problems, to diagnose certain conditions like pregnancy, sexual abstinence advice, if sexual partner had sex-related issue, if you are a victim or accused in sexual abuse. Now how to spill your secrets about your sex life. There is nothing to feel embarrassed about. Your secrets are in safe hands. Use this opportunity to clear your doubts. Every question asked has a reason behind it. And don't get offended on questions concerned about sexuality, sexual practices like fellatio, analingus or cunnilingus, frequency, recent sex, sexual partner, sexual abuse, etc. Your discomfort might make your physician miss few important questions, so be comfortable. You can talk directly by using your own words even if you think they are slang. All words are derived from A to Z, and when no letter is considered indecent, then why words made by them? God, why did I even tell this? I wonder what comments are ahead. Only autoeroticism is personal, so it is good to borrow some time to inform your sexual partner and take his or her consent to disclose sensitive information, and at the same time tell him or her that they may have to attend to one of your treatment sessions. Be confident as you speak to avoid unnecessary repeating. It is part of routine examination, so prepare yourself whenever you visit doctor. If you ask me, one of the happiest things is when you can find a doctor who can deal with sensitive matters with ease. Comment below, share to the relevant, like and subscribe for future videos. Thank you.